Thank you, Madam Deputy Speaker. I think the Minister has done a valiant effort at trying to dissuade some of us from supporting the workforce amendment, but I don't think he's kidding anybody, and I suspect he knows it. Today we've learnt that public satisfaction with the NHS is at its lowest level since 1997, and I don't think we should underestimate the blow that that news will deliver to those health and care workers who do turn up, who are doing an amazing job and who go above and beyond every single day. To say that that news is dispiriting would be an understatement. And I think it is important that they know that the public and every member of this House loves our NHS. It's just that we want it to work a bit better. It is hardly surprising that people's biggest frustrations are waiting times, a lack of proper funding, and staff shortages. These aren't the fault of health and care workers. They are the fault of this Tory government, which is driving our health and care services into the ground. Now, Cancer Research UK says that without the workforce amendment, this bill will fail to address the biggest barrier to achieving world-class cancer outcomes in the UK, the staffing shortages and pressures. The King's Fund has said that the health and care workforce crisis will be the rate-limiting factor in reducing the NHS elective care backlog. Madam Deputy Speaker, this amendment may not be a silver bullet, but it is the closest thing to it, and which makes it all the more frustrating that the government won't accept it. As I suspect the Minister knows, the government's objections just do not stand up to scrutiny. As the Right Honourable Member for South West Surrey has said, Framework 15 simply sets out the number of staff which the government thinks it can afford, rather than the staff that we actually need. And I would urge the Minister to see what message, or to think about what message, this sends to my constituent, who is a newly qualified midwife. She wrote to me just a couple of months ago and said, "I'm extremely concerned about the crisis in maternity care. This isn't caused by COVID-19. The systematic failings have been crippling the service for a generation, but the pandemic has made a bad situation worse." She says, "I am being harmed. My clients are being harmed. Staff are being harmed. For every 30 newly qualified midwives, 29 are leaving." She said parents are reporting bullying and coercion, threats are being used to ensure compliance, unnecessary medical interventions are at epidemic levels, trauma amongst parents and midwives is rife. She said concerns are being missed and interventions are being made too late. The reason for this? Staffing problems. If that isn't a wake-up call, I don't know what is. Very briefly, Madam Deputy Speaker, I'd also like to express my concern about the powers that will go to the Secretary of State under this bill. At best, it will create a bureaucratic nightmare, and at worst, it will lead to meddling and politicisation of the day-to-day running of the NHS. The government has tried to argue that the pandemic showed the need for the Minister to have more powers, but we know that during the pandemic, the Secretary of State had powers over PPE and test and trace, and both of those were extremely badly handled. The operational independence of the NHS is critical, and that is being undone by the introduction of the Henry VIII powers in this bill. So Liberal Democrats will oppose them. Finally, in my remaining few seconds, I would like to congratulate the Right Honourable Member for Chingford and Woodford on his impassioned speech. I agree with him wholeheartedly. We have a duty as a nation and as a society to ensure that goods used in our publicly owned NHS are not tainted with modern slavery or linked with the behaviours that may lead to genocide. Thank you.